Welcome to Skintap Stories. Today we're sitting down virtually with Dr. Morgana Colombo and her patient Adelle.
Oh, hi everyone. I think some of you are familiar with me. I'm Dr. Colombo. I'm one of the dermatologists at Skintap. I own a private practice in Western Virginia and one of the founding doctors of Skintap.
My name is Adelle. I'm a lawyer and a mom, and I live in Northern Virginia.
Adelle, why did you start treatment with Skintap and what were your biggest skincare concerns?
Well, I started out because I'm a pretty busy person. I'm a lawyer in the daytime. I have a family, a puppy and a daughter, and they both keep me very busy. And then I also run a nonprofit in the evening in my spare time. So I don't have a whole lot of extra time to devote to just taking care of myself. So I was looking for a fast and efficient kind of way where I could see somebody who could address the problems that I had. And my major concerns were I had brown spots that were forming kind of on the sides of my eyes and just various darker freckles on my nose that were just distracting to me and bothersome. And I also had some wrinkles that I was concerned with. There were fine lines that were starting to show up kind of in my forehead and in like the under parts of my eyes. And I had also lost a lot of fat in my face just from weight loss over the years. And I wanted to make sure that I kind of retained a more youthful look. And I felt like I needed to kind of replenish some of the structure of my cheekbones.
Adele was a very good comprehensive patient as per our Skintap definition of types of visits that we see. So I saw her for a medical concern, which was hyperpigmentation, aka brown spots on her face, and then we also addressed her cosmetic concerns. In her case, as she mentioned, she had lines of motion on her forehead, crow's feet, and in between the eyes. So those are the wrinkles that she described. And in Adele, lost a lot of weight over the years, and with that weight loss and just the aging process also, she also had a lot of volume loss on her face. So we made recommendations when it comes to the volume loss. Going back to the issues, so when it comes to the hyperpigmentation, that was her medical concern. We actually, made a few recommendations. It was a comprehensive plan for that. So number one, we placed Adele on a topical regimen. I gave her one of our specialty compounds, which has a little bit of like tretinoin, a little bit of a bleach. Also made some recommendations on a good moisturizer and a good sunscreen. So that was the start, her topical regimen. She used that for about 2 months. And then at that point, I recommended that Adele have some laser procedures. So she had actually a few laser procedures recommended through my cosmetic consultation. She had a pico laser done to spot treat some of her bigger brown spots. We actually used the PicoA device. And then after that, we used an IPL combined with an erbium ablative, like fractional laser, to just kind of like even out the pigment. So she had 2 laser treatments and of course the creams that, I initially mentioned. With that combination, she was able to achieve some really great results when it comes to her hyperpigmentation. Her other concerns, the wrinkles and the volume loss, were also addressed through our cosmetic consultation. So she was referred for some procedures that would address that. And those procedures were Botox for the wrinkles on the forehead, crow's feet, in between the eyes. And for the volume loss, she had filler. In her case, we pen volumized her face. She had filler under the eyes, on the cheeks, on the lower face. So it's pretty much a little bit of like filler everywhere, which is the approach that we use in this day and age for natural results. And between the fillers and the Botox, I think Adele was pretty satisfied with, her improvement in a very natural way.
Adelle, how long did it take you to notice a significant change in your skin from Dr. Colombo's treatment plan?
The creams that I was using, I started using them earlier in the summer, and I had a lot of sun damage. I run outside, and so I get a lot of just a lot of sun exposure. And no matter what I do, no matter how much sunblock I've used over the years, the spots and the freckles, they just keep coming. I think that the cream that I used at first to kind of lighten them actually was pretty effective. It did a good job at kind of reducing the appearance, the darkest of the spots on my face. I don't think that it would have been enough to clearly do what those lasers did. I mean, the lasers were incredible, but the cream really did make a difference, and I do think that it reduced the appearance of the freckles and the darker spots on my nose especially. The creams for the morning and the night creams that were more targeted for wrinkles and texture of skin also really worked pretty quickly. I'd say within maybe 3 or 4 weeks, I started noticing that there were fewer fine lines, that things looked just a little more dewy, and that my skin was a little fresher and maybe just a little more elastic, I guess. And it felt good. It felt very smooth and like refined. My pores felt smaller and looked smaller, I thought. And the lines had started to diminish. So that was great. And then, of course, after the in-office treatments, that was, very rapid. You could notice the difference almost immediately. And then, it took a couple of days for everything to kind of calm down afterwards, because right as soon as you have it done, you look a little different for a couple of days, but it kind of takes a moment to settle. And then you look great maybe a week after the procedures.
Also, it depends on what I'm evaluating. If we're looking at medical concerns, such as acne, rosacea, hair loss, hyperpigmentation, we, just fine tune to those concerns and recommend, creams or pills or whatever is necessary. When it comes to the cosmetic evaluation, I know people in general are going to be concerned about one thing or another, but we are going to give everybody a full cosmetic evaluation. So we're going to look at the color, changes that they may have. We're going to look at, texture changes. We're going to look at lines, those being lines of motions or fine lines. And we're going to look also, of course, at change in laxity, meaning, loss of strength on the skin and changes related to gravity and aging. And we're also going to look at volume loss.
Adelle, how was your experience seeing Dr. Colombo virtually and being referred for cosmetic procedures?
I have absolutely no complaints. I'm really grateful for how rapid everything was. There was not much in the way of complications. It was efficient, and I would recommend it.
When we do the virtual evaluations, those are done very quickly. We're going to get back to people within 48 hours. If they need procedures, we're going to refer out to our trusted network of doctors, and they're going to be able to get those procedures done at their convenience fairly quickly also. So that's going to be one of the big advantages of Skintap, is that, we're going to be able to get people into trusted, skilled cosmetic physicians within a very short window. In general, if you would call those offices, you'd probably have to wait like 2 months to get in. So our goal is to, direct patients' care and get them in much quicker than that. Of course, in a convenient manner, in a way that fits, that person's schedule.
I've told several friends about it, and they're anxiously awaiting the opportunity to get in and get started. I absolutely would recommend it.
Thank you for joining us today on Skintap Stories. Be sure to follow us on social media for all the latest and greatest on Skintap. Skintap gives you access from the comfort of your home to connect with top-rated, board-certified dermatologists on your skincare concerns and referrals for cosmetic medical treatments.